Welcome to World of Marketing Podcast, a Foster Web Marketing production. Here's your host, Tom Foster.
Hey everybody, it's Tom Foster on the World of Marketing. And here I am today with my good buddy, Dr. Christopher Sendi, who is a repeat podcaster, right?
Correct.
This is your number 2 time, and only special people get 2 times. And, you know, the thing with Dr. Sendi is that he's my doctor. And I've been coming to Dr. Sendi for 2 years now.
At least.
And he has helped me, and those of you that know me for as long as you've known me have probably seen a big difference in me in the last 2 years. And it's because of this man right here. He's a miracle worker. And I wanted to, this is actually also our first podcast, right, Thomas? Outside of Zoom. So after the COVID, well, we're still in it, but we're, not going to be in Zoom land, and we want to start doing these podcasts like we used to. So we came out to Dr. Sendi's office. So we got some footage that we'll show you about his office and about what's going on out here. He's expanding, right?
Correct.
So let's talk a little bit about what exactly you do in here. So what's going on here in Dr. Sendi's office?
Well, we do quite a few different things here in the office. I look at patients from kind of an integrative perspective. We deal with addiction-related concerns. We deal with mental health as well, which flows between addiction and a number of other medical problems as well. We also take care of medical weight loss and depression, suicidal patients. And also pain management. And we integrate those all together because they actually are the same conversation each time.
Well, that's how I got here. I got here when I was trying to get myself from being addicted to alcohol. And I came in here and talked to you, and I was like, ketamine, what? Whatever with that. And I think that the first thing that you got me on, you explained it all to me, like how people get addicted and what to do about it. And I think I was first treated with naltrexone and gabapentin.
Correct.
Right? To help me with my anxiety.
Right.
And then later on, I got started with the ketamine, but it wasn't until, I wish I'd started earlier, honestly, because that's ultimately what kicked it for me, the addiction. But you can, this helps with anything.
Yeah, so ketamine, you're referring to ketamine therapies. It seems like a snake oil type medication because it hits so many
it's got a bad rep, right?
Right,
It's like party drug, Special K, all these names for it.
Correct. And
it's in the same family as LSD and whatever.
Right, and that's an unfortunate thing. It was a branding issue because, mushrooms are magic, but, ketamine is horse tranquilizer. And the sad thing about that is that ketamine is FDA approved for anesthetic purposes. It's been FDA approved since 1970. It is the safest drug on the planet. Tylenol kills more people per year than ketamine ever would in 1,000 years. The World Health Organization has ketamine on its must-have list for every country in the world simply because it's so safe and effective as an anesthetic agent. And unfortunately, the branding of ketamine, back in the days when it was used, and it still is used for raves and parties, it unfortunately devaluated the actual benefits of ketamine. Just like any other medications could be abused, misused. We've seen that with Percocet and OxyContin and a number of other medicines that really serve great purposes for individuals who are suffering. Unfortunately, because of that branding, I think a lot of people are being denied a therapy that is rapidly effective, and greater than 70% of treatment-resistant patients who come walking through the store will leave happy. Not because they're high on ketamine, but simply because over time, the neural circuitry that has caused them to feel horrible in inexplicable ways is effectively rerouted, and it changes not their personality and not their behaviors, but basically their ability to sense reward and motivation. So they feel better about themselves, more self-esteem, more concentration, more focus. They just generally feel better the way that they should feel.
That's exactly what has happened to me. When I came in here, I was a mess, a couple years ago, and I've been doing it for probably not the whole 2 years, but for a good long time. And it has changed my life. I mean, I am 100% substance free. And when I came in here, I was not. You know, I was drinking very frequently every day, and smoking marijuana every day, 4 or 5 times a day at least. And this cured me of that. It took it, you know, just made it easy to quit. It's just amazing. It reprogrammed everything, and it's because of you and this treatment. So how did you get started? Because I mean, I love your background. You know, when we first met, I know. So talk a little bit about that to everybody. I know you did in the first podcast,
Right.
but remind everybody of the crazy schedule that you were doing, Dr. Sendi.
So I was I'm originally board certified in internal medicine and emergency medicine. I did emergency medicine for 25 years, primarily night shift in the last 10 to 12 years, where I had I want to say luxury, I guess, of seeing really preventable health care issues arise every night, which really represented substance use disorder. So we would see trauma from, let's say, alcohol use, or somebody who got hit by somebody who was drinking, for example, or people that fell. And then we saw also conditions in which people overdosed or had mental health disorders, acute psychotic breaks, severe depression, suicidality, attempted suicides. And then the other side of things, which was obesity, which again, as people gain weight, they get arthritis, they get pain, they get high blood pressure, they get diabetes. Those are all preventable healthcare complications, which represented about 90% of what I did. And at 3 a.m, when there wasn't a whole lot else to think about, I would think about all these things that really we could just be preventing, which would leave us with maybe 10 or 15%, you know, of excess medical problems that we could work on in some other fashion. But when you look at the disability that mental health and all these other preventable complications cause, the lost productivity, the loss in family, the loss in fulfillment, you know, it's just devastating. And it represents, you know, billions and billions of dollars, but, you know, money can't put a figure to the human suffering that goes with that.
So you got started just as a general doctor, right, to help people in the ER, and you saw what was going on, and that's when you decided to look into like how you could prevent it, and that led you to ketamine research, or
Correct.
how did
So
that?
I always was interested in ketamine. It had actually crossed my panel of information back in the early 2000s when the evidence started coming out that ketamine represented a potential way of a rapid treatment for depression, which was a very difficult situation because individuals who are depressed can look just like everybody else. And the problem is emotional pain is different than physical pain, and it's not describable. You can't use words to really describe it, and it has such an impact on those individuals' lives, and it leads down the pathway of addiction because people find alcohol works for it. They find it works for their anxiety. It's something that leads to other complications. And so there's this bidirectional flow between mood disorders and addiction, and then of course eating disorders, which leads to obesity or anorexia, bulimia, etc.
Right.
And then it goes on from there. And so it was found in 2000 from a study by a Dr. Berman, Crystal, that ketamine was 70% effective in individuals with treatment-resistant depression, all comers. And that was repeated again in 2007 and a number of studies beyond that, demonstrating the exact same, literally statistics that ketamine was able to really impact mood effectively and rapidly. And so I was fascinated with the fact that ketamine was dealing with a totally different neurotransmitter than our traditional antidepressants, which would generally, like Prozac, treat serotonin and dopamine related issues, which would be something like Wellbutrin. And those were older models of depression that dealt with serotonin and dopamine and these lower lizard-like neurotransmitters that effectively are present in creatures such as locusts. And as I mentioned earlier, serotonin has been present for almost 200 million years in the animal kingdom, and serotonin is what makes locusts actually swarm together. So, people think of serotonin as the molecule of happiness and dopamine is the molecule of reward, but they actually represent small little ecosystems within the greater atmosphere that's controlled by glutamate. And ketamine controls glutamate, and that is our molecule of learning. but excessive amounts of glutamate actually are excitotoxic. It actually damages our neural pathways. And so with our current state of the world, where we have 24/7, lighting, we have excessive food, excessive stress, pollutants, chemical pollutants, mycotoxins, etc., and medical illness, that actually causes problems within our neurochemistry that results in the breakdown of neural pathways that leads to depression, anxiety, and ultimately addiction.
So when you got, I just love talking to you because you're so full of information. So when you're at the ER, you're seeing all these people come through there. You said, I'm going to set up my own shop. How did that work? Because I think, if I remember correctly, you were working at the ER and doing this at the same time.
Correct. Yeah, so it was a 24/7 endeavor for about 6 years. Yeah, I would actually, you would come in, I would be here until 9 o'clock at night, and then literally walk across the parking lot over to Mount Vernon Hospital, where I would do my night shift. Then come in the morning, see a couple patients, go to sleep, and then exercise for about an hour when I'd wake up about 5 hours later, and go running really fast to blow off all that extra energy and anger, and maybe do a little weightlifting, and then come right back here for another 3 or 4 hours. And my wife definitely had to put up with a lot to get this.
2 boys.
Yeah, the 2 boys. Yeah, they really had to suffer a lot with me as we kind of went through this. But it was a labor of love. Especially when it came to success stories. So, for every person that I could help out, it just really made me feel that much more awesome in a way that I couldn't really feel in the emergency department setting so much. Simply because, I didn't have the follow through that I did in the emergency department. We would see them just briefly, and then maybe again 6 months later, and that was it. And there was just never really, that's the rest of the story type of phenomenon in the ER. And I kind of love knowing what the rest of the story is and being a part of it.
And so when did you quit the ER and go with this full time? That was about a year ago.
1 year ago, yeah. So about a month before the actual COVID pandemic, I transitioned to full-time office based because it was just unsustainable. I was here way too much, and over there way too much. And honestly, I love emergency medicine. I love the stress. I love the interventions, and it certainly was a great thing, and I learned a lot from it. So I walked away from that table with a lot of information that a lot of people just don't have the luxury of seeing. So an average practitioner, an average psychiatrist stays inside the walls of their office for their 30 years of practice. And I was able to see the worst of the worst and the best of the best. Yeah. And I was able to kind of sense from a 30,000 foot view some of the larger problems that impact our society.
So, okay, and I love that now that you're doing this full time and you're, totally busy, right?
Right.
I mean, that was part of the deal, is you couldn't sustain both of them, and you've grown this so much that now you've obtained this other property and you're growing into this place. So what is going on here? Is it just that ketamine is becoming more acceptable? Is it because you don't hear much about it? So how is it growing so rapidly?
Right. So unfortunately, like a lot of good treatments out there, a lot of people focus on what's FDA approved and what's supported by academia, which is really unfortunate because there are fantastic therapies out there that work better than what we have currently or work differently. And so a lot of people do medical tourism because they recognize that. And those individuals are well read, but unfortunately it's difficult to interpret that data, from other countries and put it in the context of our own. So ketamine is just one of many therapies out there that are highly effective for a medical condition. For example, we were discussing earlier about smoking cessation. And there is a medication, it's actually a nutraceutical called cytosine, which is actually from a plant in Bulgaria. And they discovered it in World War II when the Bulgarians ran out of cigarettes, and they found this plant had this nicotine-like quality. And it was actually subsequently discovered that they could actually increase people's cessation rates for cigarette smoking by using this substance. And so cytosine, otherwise known as tavarabol in that part of the world, is more effective than any of our current treatments here. And it's been written up in the New England Journal on 4 occasions, with even studies demonstrating it's better than what we have. And there was an editorial in the New England Journal saying, well, why aren't we using this stuff? Well, the reason we're not using it is because it doesn't bring money to any particular pharmaceutical company. And so that's the problem. But just because something is FDA approved doesn't make it more effective or better than something that's not FDA approved, because there's been plenty of substances like fen-phen that is FDA approved, but yet taken off the market because it causes heart defects, or blood pressure medications that have been taken off the industry list, or even lorcaserin, a weight loss medication that was taken off last year because of cancer risks. And yet there are things that are not FDA approved that we use as off-label, like aspirin, for the treatment of heart attacks. It's not FDA approved for that, but yet we all know aspirin for heart attacks. And so,
that's
again,
interesting.
The FDA approval process just represents a way of really protecting a company's investment in a particular medication. And I get it, they have to make money. It's the way that they can obviously sustain R&D to make the next best thing.
Yeah, but there's a lot of stuff out there that probably should be getting into the hands of people. So is ketamine, is it FDA approved or not?
S-ketamine is FDA approved as a nasal spray in the office setting. So when you look at ketamine, it was FDA approved for anesthetic purposes in 1970, but it is generic. And so companies recognize that ketamine is just working. It's working great. All molecules out there that we have a right and a left-handed form. They're mirror images. And using that information, a pharmaceutical company recognized that and actually took one of the forms of the ketamine, the S version of it, and went ahead and did research on it, recognizing that they probably had a winner no matter what they did. And with that research, it demonstrated efficacy for office use for depression. And it's a form of a nasal spray called S-ketamine that is used twice a week for 4 weeks in the office, and then monthly thereafter. And that one is FDA approved. And it's different than the racemic mixture, because that actually has R and S-ketamine. And you're showing me a bottle of a home-based ketamine therapy, which we've been using for years before S-ketamine was actually sent out there. And we all know that the R and S-ketamine works better than the regular S-ketamine alone. So the one that we've been using is really the precursor to this FDA-approved version. And that one actually can go home and be used in a safe and comfortable environment, whereas Spravato has to be used here.
I got it.
And it's a totally different phenomenon.
It's a drip, right?
It's actually not a drip. It's a nasal spray. Now, the fancy thing about it is that each bottle of S-ketamine, and there's a brand name to it. I don't know if I'm allowed to mention brand names, but they cost like $1,200 to $1,300 for one spray set. So every time they come in, that bottle is like $1,300, $1,400 if you paid out of pocket. And the actual cost of the medicine's probably 50 cents. But you're paying for the research and you're paying for the marketing and everything else. But they have to come in, they get sprayed, they sit here for 2 hours, and then they go home, come back a couple days later, do the same thing. Its efficacy is nowhere near as much as the compounded version, which many people have come to us having used the FDA-approved version and had better success with what we do.
Right. And so what is the difference with the infusion ketamine?
So the infusion of ketamine enables 100% absorption rate with an area under the curve of basically bathing your brain in ketamine to effectively reach the areas that it needs to be reached. And basically your liver is not involved. None of the other areas are involved. You actually get efficacy immediately. So we know exactly how much you're getting, and it's controlled. So if you feel anxious, we can stop the drip, or we can give you something to relax you. And likewise, if you feel nauseated, we take care of that as well. But if you use a shot, an intramuscular shot, or a nasal spray, then you basically can't take that back. And so it enables us to really get higher doses of ketamine inside the bloodstream, especially to where it needs to be, which is, of course, the central nervous system.
Have you ever had any trouble with any patients here that have been infused? Or
Great question. And yes, and the biggest problem we have is nausea. And that's probably about maybe 1 in 9 patients, but we give medications for everybody so that they don't get nauseated. And so with the antiemetics, yeah, I'd say about maybe 1 in 20 still has some problems. So we use everything from scopolamine patches to Phenergan to Reglan to Compazine. I mean, we spare no expense.
That's all nausea medicine.
All nausea medications, right. Absolutely. It's like that is like the worst thing, and I hate nausea.
So nobody's
personally.
like freaking out and running and crawling on the walls and
no, we're
losing it.
The good thing about a drip is that we basically do escalating doses. So your first drip is designed to be therapeutic, but at a dose that's comfortable, and then we escalate each dose after that. And it's tailored to fit. So if you start to feel uncomfortable, you just basically press the button, we slow it down, we stop it, or we give you something to relax you a little bit.
And I personally have been on the journey of, like, I started slow and now I'm at the top end. And, you know, it's funny because I'll be like, did you guys hear me talking? And they're like, no, we didn't hear a thing. And it's, you know, and I can tell you that, well, Thomas is also a patient here. And he is also clean and sober. And it fixed him as well as my daughter. And so, like, it is a fantastic treatment for anybody suffering. You don't need to suffer. And be also concerned about, like, the stigma of special K or ketamine. It's just ridiculous because it is a fantastic medicine. And really, if you have any questions about it, all you have to do is talk to Dr. Sendi, because he will make you feel at ease and explain anything. So, like, why does the stigma exist? Why does this exist? Like, how did it get started, like, as a party drug, and how did it get in that world?
Yeah, so if you look back at the 60s and the 70s, we had a lot of stigmatization of basically hallucinogenic type medications. Now, ketamine is technically not a hallucinogen, it's a dissociative agent. It was made by Park Davis in the early 60s. It was actually the subsequent follow-up for PCP. It is an aryl cyclohexamine, which is basically a PCP derivative. PCP was not FDA approved simply because it was just too difficult to manage. But ketamine was actually very easy to manage. It was, again, like you said, the safest drug on the planet, literally. But unfortunately, like a lot of other substances, it can get rerouted and misused in the context of other types of situations. But interestingly enough, some of the people that were utilizing this drug in particular were probably getting benefits for mood and getting less depressed, much like cough syrup. People don't recognize this, but dextromethorphan is very similar to ketamine. And that's why people will overdose, especially military. You'll see a lot of Army individuals, Marines, using quercetin as literally high doses as a dissociative agent, and it works actually for mood and antidepressant effects as well. In fact, there is a phase 3 study using Wellbutrin with dextromethorphan currently, but we actually use similar therapies here for patients that have difficult to treat depression. But again, just because a substance is not used in its intended effect, there can be reasons that a person is actually aiming to use a substance. It's not like somebody wakes up in the morning and says, I want to be addicted. I want to be dependent. Nobody does that. It's like they are using a substance for a reason. For example, alcohol. When you're young, alcohol is a great social lubricant. If you have social anxiety, it is like it makes you feel better about yourself, more self-esteem. You dance better even if you don't. And again, it just kind of goes from there. But people don't recognize the unintended consequences of certain substances used in the wrong way. So again, site and setting does have its impact on people, and also your genetics as well, and also the rest of your lifestyle. So there's a lot of factors.
Plus, there's just so much marketing on it.
Correct. Absolutely. So, yeah.
If somebody doesn't, what I wanted to do is also talk about, which is really fascinating to me, that it was used during the Vietnam War. And it was used as how?
Basically, if an individual was injured on the field, you would inject them and go. Just literally inject them and go. And it basically makes you not remember the event, which actually decreases trauma, PTSD. So we use ketamine in a lot of PTSD patients, and trauma comes in a lot of contexts. So for the Vietnam War, obviously it was a military theater, but they could actually just inject the medication and walk away with the patient, no worries about respiratory status or cardiovascular status, simply because it's a really safe medication for the transport of injured individuals. And so it's a wonderful thing for intubations and shoulder reductions and orthopedic type things that we would use in the ER setting. But in the ketamine world here, we're using significantly lower doses.
So if somebody is interested in doing this or exploring it, how would they get started?
Yeah, so most people do their own due diligence. They usually reach out to us because they've kind of looked at all avenues of traditional medicine. Their mental health journey has been significant. They've been traumatized, in their early part of their years, from a number of different things, whether it's emotional abuse, physical abuse, sexual abuse, whatever it might be. They've been diagnosed with all sorts of different mental health or disorders, and they've had significant complications from the medications that they're on, whether they're effective or not. And then of course substance abuse thrown in with that. So a lot of these individuals have either had friends that have undergone the treatment, or they themselves read about it and they've seen it in the current lay press. And more recently in the New York Times, they actually had an opinion section describing somebody who was homeless and then got ketamine therapies, and now is writing an opinion section in the New York Times.
Wow.
Yeah, so it was about maybe 2 months ago that came up. So if you look at the success stories, you always have to be worried that there's a statistical deviation because you're going to hear the success stories but not the failures. But the reality is that from what we see, it's about 80% to 85% successful in everything that we see that walks through the door. Wow. The only thing is that ketamine, it can change certainly your mood. It could change the way that you feel about yourself. It could change your general direction, your tone, make you less depressed. It doesn't change your boss. It doesn't change your preferences. So if you like pink, I can't make you like green. It can't change your car. So those are things that ketamine does not actually get involved with. But what it can do is give you the resilience and the depth and the internal ability to really cope with the day-to-day stuff that just gets thrown your direction, so you can take the knocks, and just get back up again and stand up and deal with it.
Well, I am proof and example of how it has worked, and Lord knows I tried everything else, and this is what has worked for me and for my kids. So Dr. Sendi, I can't thank you enough for that, for saving my bacon, for saving my life. You are the miracle worker. You are the best. I love you so much. You know that. Everybody, Dr. Sendi, what's the website again? You have like so many domains. He's a marketing guy too. Okay, so he's
Nova Health Recovery.
So what's the domain?
Nova Health Recovery.
Nova Health Recovery.
Nova, not Innova, but Nova. Yeah.
Right. So if you're looking for something, check them out. Talk to them. I can guarantee you that it will help you better than anything else. Tom Foster, The World of Marketing. Thank you, Dr. Sendi.
Thank you.
See you soon.